Welcome. In today's video, we're going to be reviewing the Basic Life Support or BLS Practice Examination. My name is Eunice Mathis. I'm a registered nurse and the owner of Florida Training Academy, and let us go ahead and begin. Number one, you work with an overweight 55-year-old dentist with no known history of heart disease. He begins to complain of sudden severe crushing pain under his breastbone in the center of his chest. The pain has lasted more than 5 minutes. What problem should you think of right away, and what should you do? The options are A, you're going to think that it's heartburn and tell him to take an antacid, or B, you're thinking that it's angina or angina, which is chest pain caused by a cardiac issue, and you're going to have him phone his personal physician right away. C, you're going to think that it's caused by a heart attack and phone 911. Or D, you're thinking it's an arrhythmia or an abnormal heart rhythm, and you're going to drive him to the emergency department. Severe crushing pain. If you chose C, you're suspecting that the doctor's having a heart attack and you're phoning 911. That is correct. For an emergency, we don't take our patients to or call the doctor, because the doctor's going to say, hey, you need more treatment than what I can provide, so we need you to go to the ER. And the safest way to transport that person to the ER is by calling 911. Number two, you witnessed the collapse of a 45-year-old man. You are now performing CPR after sending someone to phone 911. You have done your best to ensure that the first two links in the chain of survival have been completed immediately. What is the third link in the chain, which will have the greatest effect on increasing this man's chance of survival? If you're not familiar with the chains or the chain of survival, usually your BLS manual or in your BLS course, your video will show you. And I'm also going to show you on the subsequent page, but let us go ahead and read through the options. A, arrival of paramedics who will administer drugs. B, transportation of the man to a hospital. C, arrival of a rescuer with a defibrillator. Or D, arrival of EMS, which would be the emergency medical services, or the paramedics, arrival of EMS personnel who can do CPR. What is going to have the greatest effect to increase the chances of survival? And remember, you're already doing CPR. All right, so the answer is going to be C, arrival of a rescuer with a defibrillator. And even though I know we have the 6 links there, right beneath it, I do have the information. And so this comes directly from the American Heart Association. The first link is the activation of the emergency response system. And so that's going to be you calling 911. And this is for the out of hospital arrest. So if this happens in the home or the community versus a hospital. Second is, so you've called 911 and you've started high quality CPR. So CPR will be the second link. The third link in the chain of survival is going to be rapid defibrillation. So let's get that AED there as soon as possible so we can try to get this person's heart back into a normal rhythm. And then after that, we're going to, it says advanced resuscitation. So when those paramedics, when those firefighters, when they come, usually they know advanced cardiovascular life support. So they can start IVs, give emergency drugs. If necessary, they can even intubate the patient. Post-cardiac arrest care. And so now that they've been transferred to the hospital and they have a pulse, our job is to make sure they don't re-arrest. So we're going to find out the cause of their, cardiac arrest. Was it due to hypoxia or low oxygen? Was it due to blood clots? We need to figure out the cause, treat it appropriately, and then that is hopefully going to prevent the person from going back into cardiac arrest. And then lastly, recovery. When you think of recovery, after someone has had a major life event such as cardiac arrest, it's going to take their body time to get readjusted. They're going to be getting tired fast. So recovery not only includes the mental and emotional support, but it also includes cardiac rehab. Next, number 3. You have been talking with a 60-year-old man. He is alert and has been conversing normally. All at once, he complains of a sudden weakness on one side of his face and in one arm. He is also having trouble speaking. What is the most likely cause of his problem? A seizure. B, a heart attack. C, a stroke. Or D, diabetic coma. If you said C, a stroke, you're absolutely correct. And so strokes or cerebral vascular accidents are caused by either a blockage or a bleed in the brain. This is a medical emergency. Keep the person calm. You can do the FAST assessment. FAST is look at their face. One part will probably be drooping, which means it's asymmetrical. You can ask them to raise their arms. More than likely, one arm won't raise as high as the other. You can ask them to say their name so that S, you can hear them speak. Normally, it's going to be garbled. So that will be assigned to T. Call for help. Time to call 911. So let's do our FAST assessment again for strokes. Face, arm, speech, time to call. Keep the person comfortable. Do not put anything in their mouth. Don't give them anything to eat or drink. And when they get to the hospital, we'll find out the cause of their stroke and then go ahead and start the appropriate treatments. Number 4, you remove a 3-year-old from the bottom of the shallow end of a swimming pool. You find that she is limp and unresponsive. No other person is available to help. When should you phone 911? A, after you have given the child 2 minutes of CPR. B, as soon as you remove the child from the pool. C, when you see that after several minutes of CPR, there is no response. D, after giving a few ventilations or breaths and before beginning chest compressions. So this was an unresponsive child who's in cardiac arrest. When do you phone for help? The answer is A, after you've given the child 2 minutes of CPR. So for pediatric arrest, normally it's not caused by their heart, it's caused by their lungs. So in this case, the child drowned more than likely. And so the lungs are filled with the pool water. I need for you to go ahead and do 2 minutes of high quality CPR, which would be about 5 cycles. And that's going to make sure that you're perfusing the oxygenated blood that's still within their body. When you do those chest compressions, we're perfusing blood to the brain. If you have your cell phone, well, then, it's going to be a little bit easier because you can just pull out your cell phone, call 911 and do CPR while the rescuers are on the phone with you. However, this was not the situation for this particular question. You didn't have a phone there with you. So you'd have to do 2 minutes of CPR, get some blood flowing, and then leave to call 911. If the child is of a size where you can pick them up and take them with you, then by all means, please do so. Number 5, you are a medical advisor helping set up a public access defibrillation program at a local shopping mall. The mall has purchased an AED. The mall personnel director asks, if AEDs are so foolproof, why do security guards have to learn CPR and be trained to use the AED? Which of the following is the best explanation for the need to train rescuers to perform CPR and use an AED? All right, so A, rescuers don't need to learn CPR if they can use an AED. B, rescuers need to be able to verify the rhythm analyzed by the AED. C, rescuers need to know when and how to use the AED safely and how to perform the steps for CPR for unresponsive victims who are in cardiac arrest. Or D, rescuers will need to learn to maintain the AED and repair it if something goes wrong. And so what do you think the responsibility will be for mall personnel, such as security guards? Do you think they're repairing AEDs? Do you think we're going to teach them how to analyze heart rhythms? All right, and so if you said no, you're right. The correct answer is C. Those rescuers need to know when and how to use the AED safely and to perform the steps of CPR for unresponsive victims who are in cardiac arrest. And if you're enjoying the video so far, don't forget to subscribe to our channel. Florida Training Academy is a nurse-owned CPR and safety training company. We have so many videos, whether it's ACLS, BLS, PALS, and also CNA to help our students pass their exams and get to the next level. So please like, subscribe, and share. Continuing, number 6, you are responding to an emergency call for a child who was found unresponsive in her bed with no sign of trauma. Unresponsive in the bed, no trauma. How should you open her airway? A, place your fingers in her mouth and pull forward on the lower jaw. B, do the jaw thrust maneuver. C, tilt her head and lift her chin. D, pull her tongue forward. All right, so what's the best answer? If you said C, tilt her head and lift her chin, you're absolutely correct. There was no trauma, so you're just going to do the traditional head tilt and chin lift. Make sure you squeeze the nostrils before you administer those 2 breaths. If you don't squeeze on the nostrils, the air is going to escape the nostrils whenever you breathe into the victim's mouth. 7. Before providing rescue breaths for an unresponsive victim, you must check for breathing. You do this by listening and feeling for airflow through the victim's nose or mouth, and by A, looking into the victim's mouth to see if anything is blocking the airway, B, shaking or tapping the victim's shoulder to stimulate him to breathe, C, checking the pupils, or D, looking to see if the chest rises and falls as the victim breathes. All right, and this is an easy one. The answer is D, looking to see if the chest rises and falls as the victim breathes. And if there is no chest movement, you are to assume that the person is dead. And of course, for BLS personnel, we also will be feeling for a pulse. But if the chest is rising and falling, check for the pulse. If there is no pulse, make sure you begin CPR. Number 8, you're in the hospital cafeteria where a woman appears to be in distress. She is grasping her throat with both hands. What should you do to find out if she is choking? A, give her 5 back blows. B, give her 5 abdominal thrusts. C, ask her, are you choking? And be prepared to provide 5 abdominal thrusts. Or D, shake her and shout, are you okay? All right, you want to get permission. So the answer is going to be C. You're going to ask her, are you choking? And of course, if she says yes, you're going to go ahead and give those 5 abdominal thrusts. And you would continue those abdominal thrusts until the object is expelled or until the person actually becomes unconscious. Number 9, you are providing rescue breaths for a child using a bag mask device. What action will confirm that each of your rescue breaths is adequate? You're giving her breaths using the bag mask device. How do you know that what you're doing is actually working? A, you're going to determine the child's weight, calculate the tidal volume, and deliver the amount of air. My babies, my babies, my babies. That sounds like that's above your pay grade. Remember, this is basic life support. If you have to know what tidal volume is, more than likely that's advanced life support. All right, and so B is observing the child's chest rise with each rescue breath. That one sounds more logical. C, choosing the correct bag mask device, which will ensure delivery of adequate breaths. But sometimes there's equipment failure. So just because you choose the right size doesn't ensure that the actual breaths will be going through. So I'm still thinking about B, observing the child's chest to see if it rises with each rescue breath. Or then D, delivering breaths quickly with high peak inspiratory pressures. And again, if it's some big word, more than likely that's ACLS, and that's above your pay grade for BLS. All right, so let's see what the options are or what the answer is. And the answer is B. You're going to observe the child's chest rise with each rescue breath. And I want you to notice there, in the hospital, you may call those AMBU bags, but for most national standards, such as the American Heart Association, they won't refer to a brand name such as AMBU, a maker of a bag mask device. But what I want you to see here is that there are different size bag mask devices. And so the larger one is for adults. The one in the middle would be for your pediatric population for children. And then, of course, the one on the very end is for infants. And so you want to make sure you have the appropriate size bag mask device and that you're checking for chest rise whenever you administer a breath. Number 10, what is the correct depth of chest compressions in an adult? A, as deep as possible. B, up to 2 inches. C, between 2 and 2.4 inches. Or D, at least 3 inches. How deeply do we compress? All right, if you said C, between 2 and 2.4 inches, you're absolutely correct. You'll also hear us say 1/3 the anterior posterior view of the chest, or that side view of the chest. So if you have a very obese patient, we can't be compressing 2 to 2.4 inches. We want to bring that chest 1/3 of the way in. 11, how long should a pulse check last? A, as long as it takes to find a pulse. B, no more than 2 seconds. C, no more than 5 seconds. D, no more than 10 seconds. How long can you take to find a pulse to determine if you need to start CPR? That answer is D, no more than 10 seconds. And 10 seconds is a common answer for the American Heart Association's basic life support exam. So no more than 10 seconds. 12, where should you check for a pulse in an adult? A, carotid artery, B, brachial artery, C, femoral artery, or D, radial. Carotid is the neck, brachial is the arm, femoral is the thigh, the hip area, and then D, radial would be the wrist. So whenever someone's in cardiac arrest, we're not going for distal pulses. We need to be closer to the heart. So which of those would be closest to the actual heart itself? And that answer is going to be A, the carotid artery. And so if you notice there in the image, it shows that we're on the side of the neck where the groove of the neck is, and we're going to press in. We do not use our thumb. We use our index and our middle finger. And you can also use your ring finger if you need, but 2 or 3 fingers excluding the thumb, and you're going to be holding it for no more than 10 seconds. If you don't feel a pulse, we're going to go ahead and make sure we call out for that AED, and we're going to start our high quality CPR, beginning with chest compressions. 13, where should you check for a pulse in an infant? A, carotid, B, brachial, C, femoral, or D, radial. And now infants are a little bit different because of their anatomy. So the correct answer is going to be the brachial artery. And so infants usually have a larger head, so it's really hard to find their neck. And so it's going to be harder for you to locate that brachial artery, harder for you to locate the carotid artery. So the best rule of thumb is just to use the brachial artery, which is in the inner aspect of the upper arm where the check mark is right here, okay? 14, a child is gasping for breath, but has a pulse rate of 100 per minute. The rescuer should A, start CPR beginning with compressions. B, give 1 breath every 6 seconds. C, give 1 breath every 2 to 3 seconds. D, do nothing. The child is not in distress. All right, so the statement says the child is gasping for breath. That is abnormal. That is a sign of a medical emergency. So D is not the answer. We're not going to watch a child gasp for breath. They have a pulse rate of 100. So their heart rate's okay. What we want to do in that scenario is supplement oxygenation. So we don't have to do A. We don't have to start chest compressions because their heart rate is okay. They're still alive, but they're gasping for breath, and we're not going to do D. We're not going to do nothing. So how frequently do you give a rescue breath to a child? Is it 1 breath every 6 seconds or 1 breath every 2 to 3 seconds? Good job. If you said C, 1 breath every 2 to 3 seconds, you're absolutely correct. And remember that if we're trying to prevent a cardiac arrest in a pediatric, in a child or an infant, we need to supplement that oxygen. Because if they were to go to cardiac arrest, usually it's not due to ventricular fibrillation or an abnormal heart rhythm. It's more than likely their airway. Maybe it's anaphylaxis. Maybe it could be something's in their actual airway. So we want to make sure we supplement and give those breaths. And it's going to be 1 breath every 2 to 3 seconds. Number 15, a child is not breathing, but has a pulse rate of 50 per minute. The rescuer should A, start CPR beginning with chest compressions. B, give 1 breath every 6 seconds. C, give 1 breath every 2 to 3 seconds. D, do nothing. The child is not in distress. Going back to the question. The child is not breathing. So obviously the child is in distress. So it's not D. Now the difference is in the last scenario, the child had a pulse rate of 100. According to the American Heart Association standards, anytime a child or an infant has a heart rate less than 60, with signs of poor perfusion. So normally poor perfusion, I hear a lot of students say cyanosis or turning blue, but I'm African American and I don't turn blue. My son would not turn blue. Neither would a dark-skinned Asian, dark-skinned Latino. We're not going to have that type of color change. So one of the best things to check for is going to be the capillary refill. And if it's taking longer than 2 to 3 seconds for the blood to refill into our nail bed, that would be a sign of poor perfusion. Others may say you can check the gums. I don't know if the gums are naturally dark, so I'm not going to be checking the gums. I'm more than likely just going to look at the skin, look at how this child is responding. Right now, this child isn't breathing. Heart rate is 50. According to American Heart Association standards, we do not wait for a child or an infant's heart rate to be zero before we start CPR. Remember, they breathe faster than adults and their heart beats faster than an adult's. So by the time their heart rate gets to 50, that's close enough to zero for me to start CPR. So the correct answer for 15 is A. We're going to start CPR beginning with chest compressions. 16. A 70-year-old man who has been eating steak in a restaurant abruptly stands up and grabs his neck. The rescuer determines that the victim is choking. The best response is to A. Use back blows. B. Do nothing. Wait until the victim becomes unresponsive and then start CPR. C. Use abdominal thrust. D. Use upward chest thrust. All right, what do you do if someone stands up, grabs their neck, and they indicate that they're choking? You're going to do C. You're going to use abdominal thrust, formerly referred to as the Heimlich maneuver. 17. An infant who has been choking becomes unresponsive. The rescuer should. And this is going to help you on your American Heart Association Basic Life Support examination. Anytime a choking victim becomes unresponsive, they have lost so much oxygen until they're no longer moving. We're going to assume the person's dead and start CPR. But let's go through all our options. Anytime, regardless of the age, anybody who is choking, when they stop moving, they become unresponsive, unconscious, we start CPR. But here we go. Options are A, alternate back slaps and chest thrust. If they were still moving, yes, but this infant is no longer moving, they're unresponsive. B, perform a blind finger sweep to attempt to remove the obstruction. We never perform blind finger sweeps. You'd only do a finger sweep if you could see the obstruction. C, attempt to dislodge the obstruction using abdominal thrust. And again, it's too late to try to dislodge anything because at this point, the infant is now unresponsive. We need to focus on circulating whatever oxygen is still within their system. And we're going to do that by D, beginning CPR. Okay. And the reason why I have that image there is because most of you all know about the two-finger technique, but in our classes, we notice that especially if someone has arthritis or their fingers may tire really fast, or even though we ask them, as a healthcare provider, not to have on those fingernails, sometimes those fingernails are long and they get in the way too. So another technique they can use is they'll wrap the four fingers around the back, make sure the infant's actually on a flat surface, and then the two fingers will meet in the front and the center, and they can do their compressions that way, and it seems to be less taxing on our students. And we call that a two-thumb encircling hand technique. Number 18, efforts to relieve choking should be stopped when A, the obstruction is removed, B, the victim becomes unresponsive, C, the victim begins breathing normally, D, when any of the above occurs. When would you stop your efforts to help a choking person? And if you chose D, any of the above, you're absolutely correct. And so we have multiple playlists. And so we also do CPR and BLS, ACLS, and PALS instructor courses. We're located in Jacksonville. And so what we can do normally is if you fly in on a Friday, of course, we get everything pre-planned. You stay overnight. We can get your instructor course completed on a Friday, and then we can have you monitored on that following day, Saturday, and you can fly out and you be an American Heart Association instructor. I like to think we're worth the drive. So again, our website is fltraining.com, and this is Eunice Mathis with Florida Training Academy. Let's continue. We have a few more questions. Number 19, in which of the following situations is moving a patient during CPR appropriate? When we move a patient during CPR, so this person's in cardiac arrest, A, the patient is lying on his stomach. B, the patient is in a burning building. C, the patient is on a soft mattress. D, the patient is in a place or position where you cannot do effective CPR. Or E, all of the above. When is it appropriate to move a patient? If you say E, all of the above, you're absolutely correct. If you're in the hospital, when you call that code, you can go ahead and press that CPR mode on the bed. That usually that will allow the head of the bed to go flat. The air escapes the mattress. Of course, you've called for help. You've pressed the cold button. You start your compressions on top of that bed. And when your team comes with the backboard, you do a lift, put the board under them. You continue your CPR. Sometimes with patients who are on COVID, they may be in the prone position, meaning that they're face down. So you would have to reposition that person, put them back on their back in order for you to start CPR. And the reason why I have this image here of a transfer is if there's a mass casualty event, some things that we don't talk about in BLS, and so I want you to confirm this with your firefighters, your paramedics, your EMS personnel, is that we have to focus on those who have a greater chance at survival. And so if we have somebody who may be hemorrhaging because they were injured, somebody else who may be having a respiratory issue, and someone who's in active cardiac arrest, which would you see first? What I can tell you is the one that you'd see last. The one that you'd see last is the one who's in cardiac arrest, because I need to help those who have a greater chance of survival. And so for basic life support, we really don't cover that, but I want you to keep that in mind, especially in these times that we're in right now, is that if there are 5 people who need aid, I need you to focus on the 4 who have the greatest chance at survival. And then if you have time to go back and do CPR, by all means do so. And if you could pull that person to safety, by all means do so. But otherwise, please focus on those who would have, again, the most chance at survival. If you're by yourself, if you can delegate someone else to assist, please do so. Number 20, in 2 rescuer CPR, where the patient is between 1 year old and puberty, the chest compression to breath ratio is. So let's talk about that. 1 year of age to puberty. What are signs of puberty? Breast development, underarm hair. And my rule of thumb is if I'm looking at this child and I've seen adults who are the size of this child, because even my son right now, he's 11, but he is a big 11. So as far as his height, so you want to be thinking about that cutoff point. So if the child has reached puberty and there are 2 rescuers, what is going to be your ratio of compressions to breaths? Is it going to be 15-1, 15-2, 30-1, or 30-2? 2 rescuer CPR on a child. The answer is going to be B, 15-2. And let's talk about the reasons why. And I'm just going to go through these numbers quickly. The compression rate for all ages, adults, children, and infant, across the board, 100 to 120 beats or compressions per minute. If it's 1 rescuer, a single rescuer, regardless of the age of the victim, it's going to be 30 compressions followed by 2 breaths for 5 cycles or 2 minutes, or until help comes to relieve you. However, if you have 2 or more rescuers and it's an infant or a child victim who's in cardiac arrest, we want you to switch your ratio from 30-2 to 15-2. And the reason why is because of the cause of the pediatric arrest. Usually, again, I said it before, if a child or infant goes into cardiac arrest, it's not their heart that was the cause, it was their lungs. And kids already breathe faster than adults anyway. So when you switch to 15-2, you actually end up giving double the quantity of breaths in the same time frame, because instead of doing 5 cycles in 2 minutes, you actually end up doing around 10 cycles in 2 minutes. So instead of giving 10 breaths, you give 20 breaths. And we're trying to provide that supplemental, that extra oxygen in order to help reverse this cardiac arrest in a pediatric victim. Number 21, over what age should you use adult AED pads? Is it 8 years of age, 12 years of age, 18 years of age, or 21 years of age? At what point do we transition from child to adult AED pads? And according to most manufacturers, it is 8 years of age. And you all, I really don't even know what an 8-year-old looks like, because again, my son was always tall for his height. And so this is supposed to be a picture of middle schoolers, which I think is appropriate. But again, if you're overthinking it, if you're like, oh my God, I don't know if this is a child or an adult, again, follow up with your paramedics, your firefighters, the people who are in your community that you trust. But I'd rather do more than less. So if I can't determine whether or not this is an 8-year-old, I'm just going to go ahead and use the higher level, okay, if there's not a parent or someone there who can assist me. Regardless, whether it's the pediatric pads or the adult pads, if at any points the pads look as if they're going to touch or overlap, that's a no-no. So you wouldn't be able to use the images that are on the pads at that point for your pad placement. The pads cannot touch. What you do instead is you put a pad on the center front and a pad on the center back. Of course, if I'm saying anything that differs from the manufacturer or your director, refer to your director of your emergency services or the manufacturer of your defibrillator. And also, whenever you do take your BLS course, your instructor should be able to support the information that I just provided to you. Number 22, what is the recommended length of time for a pulse check? Is it A, 5 seconds, B, 10 seconds, C, 30 seconds, or D, as long as necessary? And we should know this. How long do you have to feel for a pulse or to begin CPR? Yep, 10 seconds. Great job, everybody. 23, what is the approximate rate of compressions in adult CPR? I gave this to you. You should know it. Is it 60 compressions per minute, 80 compressions per minute, 100 up to 120 compressions per minute, or is it 60 to 100 compressions per minute? At what rate do we provide compressions in an adult? All right, if you said C, 100 up to 120 compressions per minute, you're absolutely correct. We find that if you go faster than 120 compressions per minute, you do not allow the chest to recoil. And whenever you allow that chest to come back up to its normal position, you give the heart time to refill with blood. So if you're going so fast and you're just doing a whole bunch of work, you're not being effective. When we compress on the heart, we circulate the blood. When we let that chest recoil, we allow the heart to fill up with blood again. So you want to try to keep your rate between 100 to 120 per minute. Don't forget that for an adult, our compression depth is 2 to 2.4 inches. And we're going to do 30 compressions followed by 2 rescue breaths. Number 24, which of the following is not a component of high quality CPR? A, at least 100 chest compressions per minute. B, minimum interruptions in CPR. C, allowing complete chest recoil of, let me repeat that. C, allowing complete recoil of the chest. And then D, all are components of high quality CPR. What are your thoughts? Absolutely correct. Everything there was a component of high quality CPR. And we're just going to do our recap. Remember the rule of thumb, the 10s. We need to start compressions within 10 seconds. So that means that we get 10 seconds to feel for that pulse. And then we're going to push hard and fast at a rate of at least 100 up to 120 compressions per minute. If it's an adult or a child, we can compress 2 inches. However, if it is an infant, we're going to compress at least 1.5 inches. We just discussed allowing for a complete chest recoil so that we give the heart time to refill with blood, and we're going to minimize interruptions. I don't care what happens. Your AED doesn't work. There's equipment failure. I need you back on that chest within 10 seconds. Whenever you're giving effective breaths that make the chest rise, you don't want to hyperinflate the chest. You don't want to give a really big breath, because if you do, that extra air could go into their stomach and it can cause them to vomit. But what else it will do is it will decrease cardiac output, because now their chest wall, their chest cavity, their lungs is full of this oxygen, which means that when you go to compress, your first few compressions won't be as effective because it's all of that air trapped in their lungs. So we want to make sure that we only give a breath that results in a chest rise, not the stomach rising. And then 25, and then I have 2 bonus questions for you. What does the AED stand for? Is it A, automatic energy delivery, B, automated external device, C, automated external defibrillator, or D, autonomous energy defibrillator? What does the AED stand for? If you said automated external defibrillator, you're absolutely correct. And remember, it's going to deliver energy, which is going to try to normalize the heart's rhythm. Bonus question, can you use an AED on a pregnant mother? You absolutely can. Whatever damage you think that AED, the shock, is going to provide to the baby. Right now, mom's heart is just quivering. It is not producing any contractions. So the placenta that's feeding the baby is not getting blood flow. The baby is dying because mom's heart is not moving. We need you to use the AED on mom so we can try to get a blood flow, a pulse again, that heart contracting again, so we can start feeding the baby again. So yes, you can use the AED on a pregnant mother. Next question. Can you use an AED on someone who has an implanted defibrillator? So Papa has an incision here, elevated area. He says, if something ever happens to me, you don't have to use that AED on me because I already have a defibrillator. Is Papa right or wrong? All right, and unfortunately, he's incorrect because those batteries and those implanted devices usually last about 10 years. It could be a little more, a little less. But if someone does have an implant device, you still want to use the external defibrillator. You just don't want to put the pads directly on top of whatever implant device they have. And most cardiologists, most cardiovascular surgeons know to put the AED on the left side whenever they can. And of course, your AED pad will go on the right high area, and then the second pad would go left a little bit beneath the breast line. And guess what, everybody? We did it. We reviewed 25 questions in preparation for your BLS, your basic life support examination. Again, this is Eunice Mathis with Florida Training Academy. Our website is fltraining.com. On our YouTube channel, which is Florida Training, we have dozens of videos. So whether it's CNA, CPR, BLS, ACLS, PALS, whatever you can think of, we're here to help you pass your exams and get to the next level. So you all be blessed. Don't forget to subscribe, like, and share. Bye-bye, everybody.